Thank you for taking the time to listen to this presentation about the Humana benefits that are being offered to you through Education Minnesota. Prior to discussing your benefits being offered to you through Humana and Education Minnesota, we would like to take a few minutes to discuss Medicare in general. Medicare is broken up into different parts and are categorized by letters. Parts A and B, as in boy, are called Original Medicare. Part A is hospital insurance, which covers your inpatient care, your skilled nursing care, and hospice care. Part B is medical insurance, which covers your outpatient services such as doctor's office visits. Parts C and D are offered through private insurance companies and are called Medicare Advantage plans. You can have a Medicare Advantage plan that only covers your medical services, or a Medicare Advantage plan that covers pharmacy services, or a plan that combines the both. The plans being offered to you through Education Minnesota is a Medicare Advantage plan that covers your medical and pharmacy services. I would like to share with you a guideline that all Medicare Advantage plans must follow. If a service is covered by Original Medicare, so Parts A or B, the Medicare Advantage plan must also cover those services, and all Medicare Advantage plans are required to follow Medicare's guidelines in terms of determining medical necessity. There are a variety of arrangements that a person can choose when they are a Medicare beneficiary. I will focus on a Medicare Advantage arrangement as that is the benefit being offered to you through Humana and Education Minnesota. The Medicare Advantage plan that's being offered will combine your medical, so your Parts A and B, and your pharmacy coverage, Part D. You will have one card, which will be a Humana ID card that you will use when you go to your doctor's offices, hospitals, or pharmacies to pick up your prescriptions. Humana is based out of Louisville, Kentucky, and we currently have over 8.8 million members. Humana's plan offers you a broad network nationwide, and we have been working with Medicare since 1987. The type of plan being offered to you is a Preferred Provider Organization, or a PPO. With this plan, you have in-network benefits and out-of-network benefits. If you see a provider outside of Humana's network, you may pay more for your services. Your plan includes an out-of-pocket maximum, so the most that you'll pay over the course of the year. You have no copays for preventive care at in-network providers. And the plan also includes worldwide emergency coverage. We will be focusing on your in-network benefits. Please refer to your plan materials for additional detail on your in- and out-of-network benefits. This plan does not include a deductible. Your annual maximum out-of-pocket, or the most that you will pay for covered services over the course of a year, is $6,700. Your cost share, or your co-pays and co-insurance, varies by the types of services you receive and where you receive those services. As a high-level overview, at the hospital, when you're admitted, you will have a $454 per day copay for days 1 through 4. Outpatient surgery at a hospital will be covered with a $250 copay. Should you see a physician, your primary care physician office visit would be covered with a $15 copay, while your specialist office visit would be covered with a $50 copay. Services at an ambulatory surgery center are covered with a $200 copay. The emergency room is covered with a $90 copay, which is waived if you're admitted within 24 hours. Urgent care depends on where you receive your services. If you go to your primary care physician and the primary care physician's office bills an urgent care visit, you will have a $15 copay. If you go to the specialist, it will be a $50 copay. Urgent care visits at an urgent care center is covered with a $25 copay. Your Humana plan is also including coverage that's not covered by Original Medicare. We are including benefits for routine dental, routine vision, and routine hearing. Please refer to the plan materials for additional information. Your routine dental at an in-network Humana provider has your oral exam covered with a $0 copay, and you can get up to 2 per year. A bite wing set is 1 per year with $0 copay. And there are 2 preventive cleanings per year that are included in your plan with a $0 copay. Fillings are covered at 50%. Your routine vision as an example is just your eyeglasses or contacts. Your exam has a $75 allowance, meaning that the plan will pay up to $75, while your lens, frames, and contact lens has a $100 allowance. Medicare does not cover hearing aids. However, your plan has including some coverage for hearing aids. Your routine hearing exam is covered with a $0 copay. The fitting and evaluation, you have up to 3 per year, is covered with a $0 copay. And depending on the hearing aids that you select, you will pay either $699 or $999 copay. Please refer to your plan materials for coverage specifics and information on additional covered services. You are also welcome to call Humana. We would like to take a few minutes to discuss your pharmacy benefits. Your drug list or formulary is broken into 4 separate tiers. Tier 1 are your generic medications. Tier 2, your preferred brand name medications. Tier 3, your non-preferred brand name medications. And Tier 4 are your specialty medications. You do have a $350 deductible with this plan. However, that deductible does not apply to medications on Tiers 1 or 2. The deductible only applies to medications on Tiers 3 and 4. Also, you have a mail order option. Humana's mail order pharmacy is Humana Pharmacy. If you elect to utilize mail order, you will receive some savings for Tier 1 and Tier 2 medications. Tier 1 medications at mail order are covered with a $0 copay, and Tier 2 medications at mail order are covered with a $131 copay. You are also able to receive your 90-day supplies at your local pharmacies. If you elect to get your 90-day supply of medication at a local pharmacy, you will pay 3 times the copay, so a Tier 1 medication will be covered with a $12 copay. Something important to note is that if you do take a medication that is on Tier 4, you are not able to get a 90-day supply. Tier 4 medications are only filled with up to a 30-day supply. We would like to spend a few minutes to briefly discuss the phases of a prescription drug plan. Medicare Advantage prescription drug plans are broken out into 4 different phases: the deductible, initial coverage, coverage gap, or sometimes referred to as the donut hole, and the catastrophic phase. As we discussed previously, Tier 1 and Tier 2 medications do not have a deductible. The deductible only applies to Tiers 3 and Tier 4. When your costs, so what you have paid and what the plan has paid, reaches $3,820, you enter the coverage gap, or the donut hole. While you are in the coverage gap, you will pay 37% of the cost for generic medications and 25% of the cost for brand name drugs. The 4th stage most people do not reach, but there are some people who will hit the catastrophic coverage stage. You enter the catastrophic coverage stage when your costs reach $5,100. In the catastrophic stage, a person will pay $3.40 for generic medications, $8.50 for all other medications, or 5%, whichever is greater.
You have the option to have your prescriptions delivered by mail. Humana's mail order pharmacy is called Humana Pharmacy, and we have the pharmacies located at 3 different locations within the United States. They are in Arizona, Texas, and Ohio. If you would like to utilize Humana Pharmacy, you will need to set up an account and have your provider provide you with a 90-day script.
A question that often comes up are how Medicare Advantage plans cover vaccines and diabetic supplies. Medicare Advantage plans are required to follow Medicare's guidelines, and Medicare covers certain items under different parts of the plan. I'm going to touch on diabetic supplies first. Medicare covers diabetic testing supplies, insulin pumps, insulin for the insulin pumps under the medical or Part B portion of the plan, diabetes medications, Regular insulin and syringes are covered underneath the pharmacy or Part D portion of the plan. The other category that gets questioned are vaccines. Vaccines are divided between the Part B or medical and Part D pharmacy portion of the plan. I'm going to touch on the three most common vaccines, which are flu, pneumonia, and shingles. Flu and pneumonia are covered underneath the medical portion of the plan. Shingles is covered underneath the pharmacy portion of the plan. If you get the flu and pneumonia shot at your local pharmacy, the pharmacies do know how to bill the medical portion of the plan, and the experience will be seamless to you. If you get the shingle shot at your physician's offices do not file to the pharmacy portion of the plan, so you will be required to pay for your shingle shot and then submit a claim to Humana under the pharmacy portion of the plan to be reimbursed. One note, the tetanus shot is covered under the medical portion of the plan in cases of injury. In all other situations, it would fall to the pharmacy portion of the plan.
If you would like to enroll in a Humana plan, you have two ways to do so. The first is to call Humana at 1-800-824-8242, or you may fill out the paper application that was included in your enrollment kit. We would like to share with you what you can expect to receive in the mail once you enroll in the Humana plan. You will receive a letter from Humana once the Centers for Medicare and Medicaid Services, or Medicare, confirms your enrollment. After you receive that enrollment confirmation letter, you will receive your Humana ID card. Please use your Humana ID card when you obtain services both from your doctors, hospitals, and pharmacies. You will only need to use your Humana ID card. The last piece that you will get in the mail is your evidence of coverage. Your evidence of coverage will arrive after your ID card, and this is the detailed plan document that talks about all the specifics of how your plan covers services. This will also include your privacy notice. Humana has a tool called Physician Finder where you are able to look up which doctors, hospitals, and providers are in the Humana network. You can access this tool by going to humana.com, or you may call the number on the back of your card and a representative is happy to help you find a provider within Humana's network.
In addition to medical and pharmacy benefits, Humana is also including extra benefits and resources for our members. Humana at Home is what we call our chronic condition program. Eligible members will be contacted by Humana to see if they're interested in participating in the program. It isn't optional, but we do encourage people to work with our clinicians within the Humana at Home program. In no way are they trying to replace the relationship that you have with your physician. This is just an extra resource for our members. Silver Sneakers is a partnership that we have which offers our members free gym memberships nationwide. You can go to silversneakers.com to see where the closest gym is to your home, and you may also call Humana and we're happy to assist. Humana includes a nurse advice line, which we call Humana First. This nurse advice line is available to our members 24 hours a day, 7 days a week. If you would like to have a visit with a physician for minor conditions, we do offer the option of virtual visits. The program that we utilize is MD Live, and with the MD Live program, you are able to have an office visit with a physician from the comfort of your home. My Directives is an online resource available to our members at no additional cost. This beneficial planning tool enables members to develop an advanced directive which provides instructions to your family members and your physicians regarding your care wishes should a medical emergency arise. The Humana Welldyne program may be used after your inpatient stay in a hospital or a skilled nursing facility. You may be eligible for 10 healthy pre-cooked frozen meals that will be delivered to your home at no additional cost. My Humana is your online resource for personalized health benefits information. You may review your plan benefits or use the health and pharmacy tools to look up medical or prescription claims. You can register for My Humana from Humana.com, and you will need your member ID number, at which point you will set up a login and a password. In addition to looking at claims, you're able to search for an in-network provider. You are able to review our drug list, and you also have information regarding other benefits and resources that are available to you. Humana has developed something called a Smart Summary. The Smart Summary is a monthly summary of all of the claims that Humana received in the prior month. As an example, in February, you will receive a Smart Summary that will detail the medical claims that Humana received in January, or detail the pharmacy claims that Humana received in January. If you did not have any claims in the prior month, you will not receive a Smart Summary.
Humana has a dedicated customer service team for our group Medicare members. You may call our customer service team to answer any questions that you might have in regards to your plan. They are available Monday through Friday from 8 a.m. to 9 p.m. Eastern. If you call after hours, please leave a message and we will return your call within 24 business hours. The customer service number is 1-800-733-9064. Thank you for taking the time to listen to this presentation. Please refer to your enrollment kit for detailed information in regards to your plan, and you are always welcome to call our customer service team.